Hi friends, but I guess we know each other pretty well. I'm Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hematology, AIMS Delhi. And this is a special recall session for the FMGE 2022 exam. We'll take care of both the papers in this December exam as well as the mid-year paper. So what is the purpose of this recall? This is just to tell you that I know majority of you would have seen my videos, you would have studied from me. This is just to emphasize that I teach you this much. You'll remember this much. What is asked in the paper with respect to pathology is extremely basic and straightforward. So pathology is a subject that is going to give you a buffer. Every paper, you are going to have about 22 to 24 questions from pathology in FMG exam. If I want to cross 150 plus, ideally I should have just marked around 12 to 13 questions right in path. But majority of the students, which after studying from me, you will be marking 19 to 20 plus corrects in pathology. So let us quickly have a look at recall questions of the 2022, both the papers. Starting with the December exam. Acha, one more thing. Commit to the answer before I speak it. You will yourself realize that the paper was simple and straightforward. Starting with our first question. Young boy with small round tumor of the eye in a young child, which is a round cell tumor. Diagnosis, retinoblastoma. Associated with RB gene mutation. You know that, retinoblastoma. Plain and simple. Next, 60-year male, that is an elderly with throbbing unilateral headache and nodular thickening of the temporal artery. Just touch your forehead once and you will never forget it. Whenever we talk of temporal artery involvement in an elderly male, it is a case of giant cell arteritis. Giant cell arteritis, it is a medical emergency. Why? Because it can lead to sudden blindness. It can lead to sudden blindness. It is a medical emergency to be treated with steroids. Next question. What is the fancy name of macrophages of the liver? Kupffer cells. I need not even tell you that monocytes are the macrophages in blood. Microglia are those of CNS. Littoral cells are the macrophages of the spleen. Not concerned. Liver, Kupffer cells. Liver, Kupffer cells. Next, 20-year male with past history of upper respiratory tract infection, hemoptysis, KFT is deranged, and anti-GBM antibody is present. Which is the renal disease associated with presence of anti-GBM antibody? Goodpasture syndrome. Goodpasture syndrome, anti-GBM antibody. We see just 3 points with Goodpasture syndrome. First is anti-GBM antibody. So it is which hypersensitivity reaction? It is antibody-mediated hypersensitivity, that is type 2 hypersensitivity reaction. And organs affected are kidney and lungs. This is Goodpasture syndrome. Next question. Splenectomy is indicated in which hemolytic anemia? Dekho bache, the minute I see the options, PNH and DIC, paroxysmal nocturnal hemoglobin and DIC, disseminated intravascular coagulation, they have intravascular hemolysis. They do not show extravascular hemolysis. G6PD deficiency, it is a benign self-limiting disease. It is associated with hemolysis in spleen, but it is a benign self-limiting disease. If it is a benign self-limiting disease, I will not do splenectomy. So splenectomy is indicated in cases of HS, hereditary spherocytosis, HS, which is the most common RBC membrane defect. You know that. Next question. Which caste is Tam-Horsfall protein? Tam-Horsfall protein, which it is Hyaline caste. It is the most common caste found in urine. RBC castes are seen in glomerulonephritis. They are associated with glomerulonephritis versus WBC castes, which are seen in pyelonephritis. Obvious, WBCs are coming in. That means infection is occurring, pyelonephritis. Broad castes are a feature of chronic renal failure. In chronic renal failure, the tubules are dilated, in turn leading to formation of broad castes. Broad castes, chronic renal failure. Next, 70-year male, elderly male with multiple lytic lesions in hip, serum calcium is increased. This is the image that is given to you. Now, every FMG exam always has a question on multiple myeloma. Elderly with lytic lesions, serum calcium is elevated. Multiple myeloma. Now, examiner told you that peripheral smear image is given. Dekho bache, this was a slightly tricky question in which majority of the students went wrong in the paper. The minute you saw multiple myeloma, you tended to mark that. Multiple myeloma is a cancer of plasma cells. The second option is plasma cell leukemia. So let's have a look at that also. This is peripheral smear. How do I know that? RBCs show rouleau formation. RBCs are stacked upon each other. Stack of coins appearance, rouleau formation. This is also the rouleau formation of RBC. As compared to an RBC, you see the presence of very large cells, abundant cytoplasm, eccentric nucleus. All these are the plasma cells. Are they more than 20%? Yes, they are 100%. All these are plasma cells. More than 20% plasma cells in peripheral blood makes it as plasma cell leukemia. More than 20% plasma cells. More than 20% plasma cells in peripheral blood is plasma cell leukemia. So the best answer in this case was plasma cell leukemia. It is like acute leukemia. More than 20% blasts in peripheral blood is acute leukemia. More than 20% plasma cells in peripheral blood is plasma cell leukemia. Next, 5-year child with hematuria and RBC casts in urine. Child with cola colored urine or hematuria after history of upper respiratory tract infection. That was previous year's question only. Diagnosis, PSGN. Child with nephritic syndrome is PSGN. Child with nephrotic syndrome is MCD, minimal change disease. Next, child with periorbital and pedal edema. So both the kidney questions asked back to back. Electron microscopy shows. So firstly, child with periorbital and pedal edema. That is child with nephrotic syndrome. Which is the most common nephrotic syndrome in a child? Minimal change disease. Light microscopy is normal. Electron microscopy shows diffuse effacement of food processes of podocytes. MCD. Minimal change disease. MCD. Next. Patient died of myocardial infarction. Which is the stain used for making a gross diagnosis? Image of this was asked in FMGE 2021. We used TTC. That is triphenyl tetrazolium chloride. We use TTC. Triphenyl tetrazolium chloride. TTC staining of the heart for making a gross diagnosis of MI. Alizarin redis is the most specific stain for calcium. Alizarin redis. New methylene blue is for reticulocytes. It is for reticulocytes. Versus Mason's trichrome. Trichrome. 3 colors. Blue-green collagen, red muscle, black nuclei. So that is Mason's trichrome. So the answer in this case was TTC staining of the heart for MI, myocardial infarction. Which immunoglobulin has highest concentration in blood? IgG. Which is the most common protein in the body? Albumin. All these are recent, simple, straightforward, recent FMG questions only. Most highest concentration, IgG, immunoglobulin G. Owl eye appearance is seen in Hodgkin's lymphoma. RS cells, which are CD15 positive, CD30 positive, 15 positive, 30 positive. Other than Hodgkin's, it is also associated with CMV, cytomegalovirus, CMV, owl eye appearance. Next, adult female with headache. Radiology shows frontal dural base tumor. There is a tumor in the brain. So, with respect to FMG exam, always go for the most common. Which is the most common primary CNS tumor? Meningioma. What does meningioma show? It is associated with semoma bodies. देखो बच्चे, even if you were not aware that meningioma shows whirling, ठीक है, fair enough. You were not aware that meningioma is associated with whirling. Doesn't matter. It is associated with semoma bodies. So the answer was 1. Similar question was asked in 31st August 2020 FMG exam, in which a young female presented to OPD with recurrent seizures and epilepsy. MRI was given, histopath image was given, and it was written the tumor is associated with calcifications. Meningioma. Next. So this was the December FMG exam. And this gets us to the previous paper, that is the June FMG. Let's see this again also. Most common lung cancer. The best answer should be metastasis. Most common lung cancer, metastasis. From where? Primary site. Primary site. What is above lungs? Breast. Primary site being breast cancer. But that is not, metastasis is not given in the option. So most common lung cancer in India, squamous cell carcinoma. Squamous. Next. 10-year-old child presented with lower abdominal pain, rash and pain in joints. HSP, Hinox-Schönlein purpura. Previous 3 years, 6 papers, every paper had 1 or 2 vasculitis based questions. So lower abdominal pain in a child, most common vasculitis in children, HSP, Hinox-Schönlein purpura, Hinox-Schönlein purpura. Giant cell arteritis, we just saw in the previous exam. It is elderly with thick palpable temporal artery. Tuk-tuk are the pulses. Takayasu syndrome, pulseless disease. That is, you will have a history of feeble femoral or the radial pulse. Pulseless disease, Takayasu. The one with smoking, vasculitis associated with smoking, pain while walking, intermittent claudication, tau, thromboangiitis obliterans or Burgess disease, tau, that is thromboangiitis obliterans or Burgess. Straightforward vasculitis based questions and recent previous year questions of FMGE. Next, known case of diabetes, came with pigmentation of skin over arms and he is suffering from cirrhosis. Pigmentation of skin with cirrhosis and diabetes. What is the sexy skin color? Bronze diabetes. Bronze diabetes. Examiner even told you that on biopsy iron deposits are seen. Diagnosis, hemochromatosis. Even if the examiner had not written that iron deposits are seen, bronze diabetes, hemochromatosis. Versus Wilson's disease, which shows the presence of Kayser-Fleischer ring, KF ring Wilson's. Bronze diabetes, hemochromatosis. Another question that was asked with hemochromatosis is HFE gene mutation present on chromosome 6p. HFE and HLA, they are on the same chromosome, short arm of chromosome 6. Wilson's disease is ATP7B gene mutation versus ATP7A gene mutation, that is Menkes disease. Which all these are previous 2-year questions of FMG only. Menkes. We are just doing a very quick recap of PYQs of FMG so that we know कि what we know in pathology is more than sufficient. कि आत्मा की संतुष्टि के लिए we know stuff. Don't worry about anything. Next, keep on studying. Next, test not done during blood transfusion, hepatitis A. 5 diseases are tested: HIV, hepatitis B, hepatitis C, syphilis and malaria. Next, most abundant plasma protein, we just saw that, albumin. Child with mother having fatigue, lethargy, pallor, irritation, he is a known case of iron deficiency anemia on iron supplements. Doctor wants to start IV iron. Next investigation. So all the examiner is asking you is most sensitive indicator of iron profile. Most sensitive indicator of iron profile is, which is a storage form of iron? Serum ferritin. So the stores reduce first. Most sensitive indicator of iron profile, serum ferritin. It is the storage form of iron, ferritin. Now, again same question. Middle-aged male, calcium has increased, renal insufficiency, X-ray has multiple lytic lesions. Diagnosis, multiple myeloma. FMG exam is not complete without a question on multiple myeloma. Multiple myeloma, it is a plasma cell neoplasm. It has increased number of plasma cells. With any one graph features. Crab, calcium is increased, renal insufficiency, anemia, bone lytic lesions, multiple myeloma. Next, glioblastoma is which WHO grade tumor? Glioblastoma is associated with which colon cancer? It is associated with FAP. Which syndrome of FAP? Familial adenomatous polyposis. FAP. Which syndrome? Turcot syndrome. Remember, FAP had 2 syndromes, Gardner's and Turcot's. FAP is a wicked disease to have. So cancer with it will be wicked. Glioblastoma. Now think of it the other way around. Most common CNS malignancy. Most common primary CNS malignancy. Primary CNS cancer. Primary CNS malignancy. In children and adults. In children. Let's first start with children. Most common primary CNS malignancy in children is medulloblastoma versus adults, which is glioblastoma multiforme. So you could have done this question both ways. Medulloblastoma and glioblastoma multiforme, they are seen as cancers. So of course they are WHO grade 4. Or you could have done that they are associated with FAP. Both medulloblastoma and glioblastoma multiforme, they are with FAP. FAP, gene mutation chromosome, APC gene mutation chromosome 5. Again a recent question, Turcot syndrome. So topics are repeated. In FMG, the topics, sometimes the examiner will ask you the second line, sometimes he will ask you the fourth line from the same topic. Topics are repeated. So glioblastoma, grade 4 CNS tumor. Next, female with history of liver disease shows ground glass appearance. Ground glass appearance of hepatocytes, which is a feature of chronic hepatitis B virus infection. Acute hepatitis has Councilman bodies. Apoptosis of hepatocytes, Councilman bodies. Chronic hepatitis, ground glass hepatocytes, especially with hepatitis B virus. Same question. So in the previous year itself, you had 3 multiple myeloma questions. Elderly male, Bence-Jones proteinuria, multiple lytic lesions. Which protein is increased? Gamma globulins. IgG, gamma globulins, multiple myeloma. Next, again a repeat question. Middle-aged male presenting with very high TLC, presence of all the cells, myeloblast, promyelocyte, myelocyte, basophils and splenomegaly. Diagnosis, CML. Previous to this, in 2021, FMG exam asked you translocation 922, called as Philadelphia chromosome. Translocation 922, Philadelphia. Philadelphia chromosome. Which protein is formed because of this translocation 922? BCR-ABL. Protein formed BCR-ABL. BCR-ABL. So diagnosis, CML. Chronic myeloid leukemia. CML. Next, patient has iron deficiency anemia. Which stain is used to confirm iron stores? Girls, which wear necklaces made of pearls or the Prussian blue stain. Von Cosa. Calcium Cosa. It is the most common stain for calcium. Methylene blue, reticulocytes, alizarin redis. It is the most specific stain for calcium. Most common for calcium is von Cosa, calcium Cosa. Most specific, alizarin redis. Iron, pearls or the Prussian blue stain. Simple. So 2 questions from stains. Macrocytic anemia. देखो बच्चे, macrocytic anemia. Macrocytic anemia is of 2 types. Megaloblastic anemia. It is of 2 types. Megaloblastic and non-megaloblastic anemia. Megaloblastic and non-megaloblastic. Megaloblastic anemia is associated with folic acid B12 deficiency versus non-megaloblastic anemia, liver disease. Now think of it the other way around. If a patient has acute blood loss, assuming he is normal, it will be normocytic normochromic. Just blood loss occurred. It is normal, normocytic normochromic. Anemia of chronic disease. It can be microcytic hypochromic, but most commonly it is normocytic normochromic versus thalassemia, which is microcytic hypochromic. Next, this question again has been asked 2-3 times in recent FMG. 16-year female with microcytic hypochromic anemia. Diagnosis, iron deficiency anemia. 56-year female with microcytic hypochromic anemia, iron deficiency anemia. So whether the female is 16 years or 56 years, the answer in both cases is iron deficiency anemia. Next question. Inheritance pattern of neurofibromatosis 1. Examiner also gave you a history of capillate spots. NF1, autosomal dominant. Does not matter whether it is NF1 or NF2. Both the neurofibromatosis, autosomal dominant. Now, a couple is trying to have a child for 2 years. 2 years. This is a typing error. The couple is trying 24 years से they are not trying to have a child. UPSC का exam थोड़ी है जो निकल ही नहीं रहा. Couple is trying to have a child for 2 years. Female is okay. Male has gynecomastia, scanty pubic hair, atrophic testis. Klinefelter's. Most common Klinefelter syndrome being 47XXY. Male is XY now. 1 X increased. So the secondary male sexual characteristics reduced. 47XXY. Klinefelter's. Next, neural tube defects are multifactorial. That is why, what is multifactorial? Presence of more than one genetic plus environmental factors play a role. This is multifactorial inheritance, multiple factors. That is why folic acid is also given 3 months prior to the couple trying to conceive a baby to prevent neural tube defects. It is multifactorial inheritance. Disease is going from grandmother to father, father to son. That means the disease is not skipping generations. Now, this was a good question. Majority of the students went wrong in this question. See, bache, always take care of the tricky questions. The disease is not skipping generations, autosomal dominant. Grandmother is giving which chromosome to father? Grandmother gives X chromosome to father. So it cannot be a Y-linked disease. Father gives Y chromosome to son. So it cannot be an X-linked disease. It was autosomal dominant. It does not skip generations. It is of course not autosomal recessive. Autosomal recessive skips generations. This was autosomal dominant. Next. Cell responsible for graft rejection is T cells. But the poor T cell is like the guy in a relationship. I mean, irrespective of the disease, whether it is graft rejection, graft versus host disease, GVHD, graft versus host disease, sarcoidosis, or IBD, inflammatory bowel disease. Irrespective of the disease, who is always the culprit? Who is always the, at fault? The T cells. So, cell responsible for graft rejection, T cells. Myasthenia gravis. It has antibodies against acetylcholine receptors. Antibody-mediated hypersensitivity type 2. Now, point to be noted is, there are only 2 examples of type 5 hypersensitivity. That is myasthenia gravis and Graves' disease. Myasthenia gravis and Graves' disease. But yet type 5 hypersensitivity is also antibody-mediated hypersensitivity. The only 2 examples of type 5 hypersensitivity are myasthenia gravis and Graves. So if 5 is given in the options, that is the best answer, followed by a type 2 hypersensitivity, So 5 was not given in the options. So the answer in this case becomes type 2 hypersensitivity. Next. Female went camping with friends, bee sting injury. This is type 1 hypersensitivity. Type 1 hypersensitivity is IgE mediated response. Question previous to this, in 2021 that was asked was, same thing, female went camping, bee sting injury, type 1 hypersensitivity, which is the main mediator associated? Histamine. So same question asked twice back to back in 2 papers. Main mediator histamine, it is IgE mediated response. And lastly, dystrophic calcification is seen in D for dystrophic, D for dead or damaged tissue. It is a feature of atherosclerosis. In dystrophic calcification, serum calcium is normal. Calcium is normal. That is why it goes and gets deposited in damaged tissue. Versus metastatic calcification where calcium is high. So hyperparathyroidism, sarcoidosis and multiple myeloma show metastatic calcification. In all 3, they show metastatic calcification. In all 3, serum calcium is increased. First class. So this takes care of your both the FMGE 2022 recall questions, December as well as the mid-year exam. But needless to say, bestest of luck from the bottom of my heart. And we are in this together. Don't worry about anything. Keep on studying, keep on working. I can safely say that your pathology is in extremely good hands. It is going to give you a buffer. Irrespective of how easy or how tough the paper comes, pathology is taken care of. It is going to give you a buffer. Keep on studying and you will 100% pass. Take care and good night.